Is it acne? That's the question that we're going to discuss today. Welcome. I'm Dr. Arthur Colsky, founder and medical director of Advanced Acne Institute, and we are a dermatology practice that specializes and focuses only on acne treatment. That's all we do. So we like to share our experiences with acne sufferers who are trying to navigate the path toward clear skin. And this is only for educational value. This is not meant to be medical advice. So a common question is, do I have acne? Is it acne? Or is it something else? Do I have an allergy? Do I have a rash? Why do I have these breakouts? We have patients that come in thinking that they have a variety of different conditions. Do they have a fungus, for example? Is it, quote, fungal acne? Do they have a rash? Is it an allergic problem? So sometimes it's not that easy to tell in certain circumstances. However, typically we can decide whether it's acne or something else by looking at the presentation, by looking at the clinical features. For example, acne tends to have open pores that are clogged, and they have closed pores. So open and closed pores are called open and closed comedones. So acne is a condition that has comedones. So we look for comedones. We look for those pores that are involved, and that can give us a clue that this is acne that we're dealing with. Acne also has other clues. We look at the pimples, we look at how they present, and we get a history, and we look at and see, does acne get worse with a menstrual period, for example? Are the breakouts something that are occurring with stress? And there are a number of factors that we look at, but sometimes it's not always straightforward. There are conditions such as rosacea that can look very much like acne. However, rosacea does not have comedones. So that's one clue that we use to differentiate between the two. There are other conditions such as perioral dermatitis. That's a condition that sometimes can look very much like acne and typically occurs in the center area around the mouth. And there are clues that we can use to discern between those two conditions as well. Without going into all of the differential diagnosis of acne, there are conditions, and even allergies sometimes can look similar to acne breakouts. Fungal acne that some of my patients describe is really a condition that is different from acne, but it involves the pores. It involves a type of a fungal infection within the pores. So the breakouts can be little pimples, but they typically look different from the way acne pimples look. They're typically uniform. In other words, each one looks just like the other, whereas in acne, you can have big pimples, small pimples, they can look different. So differentiating those two is not always easy, but a lot of times can be clinically determined. So there are a lot of things to consider as to whether or not you're dealing with acne, and you really need to see a dermatologist who's an expert in differentiating those different conditions in order to make the decision whether or not it is acne and whether or not the treatment that you need to use is the right one.